Hi, welcome back. Today we'll see how to arrange airway tray. So this is the airway tray already we arranged and kept for one child. He is 4 years. So now we'll see what and all equipments is required to arrange airway tray, to arrange a perfect airway tray. Okay. Now we'll see one by one. Okay. So this is the ambo bag. In the ambo bag, the three types will be there. Three sizes will be there. So one is adult child ambo bag and neonatal ambo bag. Here, since child is 4 years, we have taken child ambo bag. Okay. So this is the O2 tubings. Whenever is using ambo bag, we need to connect. You need a O2 connections for that this tubings. After that, what we need, the mask, proper size is a mask. So I have taken number 3 ambo mask and number 2 silicone mask. Okay. So I have to check on the patients whatever is the fitting to the child, that mask need to be selected and kept. Okay. Then next comes the scopy. So scopy, so here as per the child size, we have taken the pediatric laryngoscopy with the blade. This is the curved number 2 blade. And kindly please before arranging or before keeping or before using on the patient, kindly cross check whether it's working and your light is improper. And this blade always you have to check whether it is tight or loose. It should not be loose. If it is loose, please make sure it is tight. Okay. And always make sure you are keeping one more extra pair of blade even, and the extra batteries and bulb. Okay. So here we kept number 2 curved this blade and the number 1 curved blade and number 1 straight blade. Okay. So this about the scopies. Next comes the ET tubes. ET tubes as per the formula we got for the 4-year child, we got number 5 size. So ET size. So we have taken here. Always we will be preparing one size smaller of ET tubes. For example, if we got 5, so we have taken 5 ET tubes cuffed and 4.5 ET tubes cuffed and 4 ET tubes cuffed. Okay. So and one more thing, always whenever you are keeping ET tubes, kindly make sure you are keeping plain and cuffed and uncuffed even. Okay. So for example, here this is the cuffed and we are kept even plain even. Okay. So both the ET tubes we kept it here. Next is the stillet. So stillet is very important because since the ET tubes are, it is like a rubbery kind, it will be slipping sometime. To stabilize the ET tube, sometime doctors will be asking for the stillet. So as per the ET tube sizes, you can select your stillet. If it is smaller size, then stillet. If it is the bigger ET tubes like 7, bigger child 7 size you are using ET tubes, then it will be bougie. Okay. Next is the suction catheter. So this is the anchor is very important. This also should make sure it is there in the airway tray. Okay. Anchor followed by a suction catheter. Then comes oral airway. This also sometime will be using. So in case of emergency, should not be run here and there. So make sure in a airway tray, oral airway also included as per the patient's size. Okay. Next comes is the oxygen mask. Always will be we are preparing to keep oxygen mask or nasal prongs as per the patients or high concentration mask in the airway tray, because if at all your child is undergoing any sedations or like that, so we will be requiring oxygen, or in case of child is going for any other procedures or required any oxygen, so the oxygen mask should be there with the either oxygen mask with tubings or the high concentration mask or nasal prong should be there in the airway tray. Usually we will be preparing oxygen mask. So these are the airway tray equipments. So if you are arranging like this on the as per the patient's size age, so we can attend the one intubations, or we can intubate the patients without any complications. And I think this video is helpful for you guys. Thank you for so much. Please keep supporting me.